Welcome back to UK Pension Hub. For decades, free NHS prescriptions have been one of the most valued benefits for people over 65 across the UK, giving older adults and retirees the reassurance that they could access essential medications without worrying about the cost. However, a major shift is now set to occur in December 2025, which could fundamentally change this long-standing system. The government has confirmed new eligibility rules that may remove free prescriptions for thousands of people over 65, particularly those who are not yet receiving the state pension or who do not qualify for certain benefits. Framed as part of wider NHS reforms, this decision has triggered concern among pensioners, medical professionals, and charities alike, with many warning that it could place additional financial pressure on vulnerable older adults, especially those living on limited incomes. In this video, we'll break down exactly what's changing, who will be affected, and what steps you can take to protect your entitlement before these new rules come into effect. To understand the impact of this change, it helps to first look at the history of free prescriptions for older adults. Since 1974, UK residents aged 60 and over have been entitled to free NHS prescriptions, regardless of their income or employment status. This policy was designed to help older adults manage the rising costs of healthcare after retirement, when income often decreases. The system was based on fairness and accessibility, supporting millions of pensioners who rely on medication for conditions like heart disease, diabetes, arthritis, and other chronic illnesses. Today, over 12 million people in England benefit from this policy. However, the government argues that continuing this universal entitlement is increasingly unsustainable due to rising NHS costs and the fact that people are living longer, prompting a reassessment of how prescription eligibility is structured. Starting in December 2025, the Department of Health and Social Care, DHSC, will align the free prescription age with the state pension age. Currently, the state pension age is 66, and it is expected to rise further in the coming years. Practically speaking, this means that only individuals aged 66 or older, or those already receiving the state pension, will automatically qualify for free prescriptions. Those aged 60 to 65 who have not yet started claiming their state pension will be required to pay for prescriptions, which are currently priced at £9.90 per item. The rollout will begin in early December 2025 and will gradually affect millions of people aged 60 to 65 across England. The groups most likely to lose free prescription access under this new system are individuals aged 60 to 65 who are still working and have not yet claimed their state pension, early retirees below state pension age, and older adults with modest incomes who do not claim means-tested benefits. For these individuals, prescription costs could quickly add up, potentially reaching hundreds of pounds each year. For example, someone taking 4 prescription items per month could face nearly £480 annually, which represents a significant financial burden for anyone on a fixed income. However, certain groups will still retain access to free prescriptions. People aged 66 or older who are at the state pension age, recipients of pension credit guarantee or savings credit, individuals with long-term conditions covered by the NHS medical exemption certificate, and low-income claimants with NHS tax credit or HC2 certificates will continue to benefit. It's important to note that residents in Scotland, Wales, and Northern Ireland are unaffected, as prescriptions are already free for everyone in those regions. This reform applies only to England. The financial impact on older adults could be substantial. Many pensioners managing chronic health conditions may face tough choices between necessities such as food, utilities, and essential medications. Around half of all people over 60 in England take at least 3 regular prescriptions, and research indicates that 1 in 10 pensioners already skips medication due to cost. Charities warn that the new rules could increase hospital admissions and worsen health outcomes for older adults. While government officials argue that the change promotes fairness for those still working, critics describe it as a hidden tax on aging, placing undue strain on retirees. The transition will occur in stages to give affected individuals time to prepare. In December 2025, the legislation comes into effect, followed by the NHS sending updated eligibility letters. By early 2026, pharmacies will begin enforcing proof of entitlement, and by April 2026, penalties for false claims will rise to £120 per offence. This phased rollout gives pensioners a short window to update benefits, apply for support certificates, and secure their place in the free prescription system. If you are aged 60 to 65, there are concrete steps you can take to safeguard your free prescription rights. Applying for pension credit, even for modest entitlements, can preserve NHS benefits. Using the NHS Low Income Scheme, LIS, may provide full or partial financial help. Claiming a medical exemption certificate is also crucial if you have conditions such as diabetes, epilepsy, or cancer. Checking your state pension age through the official government calculator can help you plan ahead and avoid sudden costs. Acting before December is essential to prevent automatic removal from the free prescription system. Government officials claim that these changes could save the NHS around £250 million per year, which they intend to reinvest in frontline services. Yet, analysts warn that these savings might be offset by higher healthcare costs over time, as fewer pensioners taking necessary medications could result in increased GP visits and hospital admissions. The reform also risks widening disparities between England and the devolved nations, and many view it as part of a trend to reduce age-based benefits with long-term consequences for health and well-being. From January 2026 onwards, NHS systems and pharmacies will verify eligibility in real time, and anyone claiming free prescriptions without entitlement could face penalties of £120 per false claim, repayment of prescription costs, and even potential benefit fraud investigations. Enhanced data sharing between the NHS and the Department for Work and Pensions will make it harder to conceal false claims. Public reaction to these reforms has been immediate and strong. Organisations like Age UK and the Patients Association are actively campaigning for a reversal. Protests are being planned outside Parliament and NHS offices, and petitions have already gathered over 600,000 signatures. MPs from multiple parties have raised concerns about the disproportionate impact on low-income pensioners. For many, this debate is not just about money, it is about fairness, dignity, and trust in a system designed to support those who have contributed for decades. In conclusion, the end of universal free NHS prescriptions for over 65s in England represents a historic change in UK healthcare policy. What was once a guaranteed benefit is now tied to state pension age and income criteria, leaving many older adults facing new costs. While the government maintains that this reform ensures fairness and sustainability, many see it as an added burden at a stage of life when health expenses are already high. If you are approaching 60 or are already retired, it is vital to check your eligibility, apply for all available support, and make sure your NHS records are up to date. Staying informed and proactive is key to protecting both your health and your finances. If you found this update helpful, subscribe to UK Pension Hub for detailed explanations of DWP, NHS, and pension changes. Hit the bell icon so you don't miss critical updates that could affect you and your loved ones, and stay ahead of these important policy changes. Remember, being proactive now could save you hundreds of pounds and protect your health in the years ahead, so don't wait until the system automatically removes your free prescription entitlement act today.